So my title is Discovering New Biomarkers of Response to Lung Cancer Immunotherapy using Elastic Net Regression in our programming language. For the introduction, the primary goal of this project is to identify new and robust biomarkers that can accurately predict patients' responses to lung cancer immunotherapy. The study employs elastic net regression, a specialized statistical technique, and to analyze gene expressions data from lung cancer patients. By detecting these biomarkers, the project aims to enhance the effectiveness of immunotherapy and provide a foundation for personalized treatment strategies, potentially improving post-treatment response rates and patient outcomes. So lung cancer remains one of the top causes of mortality around the globe. Some of the main therapeutic approaches for lung cancer treatment includes surgery, radiation therapy, chemo, and targeted drug therapy. Among those, an option for cancer treatment that has revolutionized the field of oncology is immunotherapy, the pursuit of which is to boost natural defenses and to eliminate malignant cells. The monumental advanced immunotherapy made in the approach to cancer treatments owes to its tolerable safety profile, therapeutic response due to immunological memory generations, and a broad patient population. Inconsistency of this benefit across patients. However, combining biomarker technology with immunotherapy can be a way to overcome this obstacle. Professionals can determine the approach most likely to benefit an individual by utilizing biomarkers, which provide unique insights about each patient's cancer and its genetic makeup, its behavior, and its interactions with the immune system. I want to talk about the data we used. It's a little classified data that, as my mentor said to me, the data used in this study consists of gene expression samples collected from 40 patients with lung cancer who underwent immunotherapy. These samples, encompassing 8,482 genes, were analyzed to understand the relationship between gene expression patterns and patient responses to treatment. The research focuses on identifying specific genes that serve as potential biomarkers for predicting patients' outcomes after 6 months lung cancer immunotherapy. So this is a screenshot from our data sets. Look like these. These are gene expressions, genes names, patients' IDs. So yeah. So the methods we used cross-validation and elastic net regression. So for cross-validation is a statistical technique used to assess the performance of a model by splitting the data in subsets for both training and testing, helping to mitigate the impact of variability of the data. Sorry for network. Wait a minute. So let's move on to the elastic net regression. Elastic net regression is a linear logistic regression method that combines L1, lasso, and L2 rich penalties to address multicollinearity of overfitting and high-dimensional data, allowing for the selection of relevant features while controlling for model complexity. So this may help you to understand cross-validation more. I couldn't open my text. Oh yeah. So for cross-validation, cross-validation is important for several reasons. For a robust performance evaluation, you can say cross-validation provides a more robust estimate of a model's performance compared to a single trained test split. It helps to mitigate the impact of random data partitioning, ensuring that the model's performance assessment is less biased. And generalization assessments. By testing the model on multiple subsets of the data, cross-validation gives you a better understanding of how well the model generalized to unseen data. This is crucial for ensuring that your model doesn't overfit to the specific training data. And hyperparameter tuning. Cross-validation is commonly used to tune hyperparameters, which are settings that control the behavior of the machine learning algorithm. By evaluating the model's performance across different parameters combinations, you can select the best set of hyperparameters. For data scarcity, when you have limited data available, cross-validation allows you to make the most out of your data set. It helps you maximize the use of the available information and make more reliable decisions about model performance. And yeah, it's about that. And in this study, several libraries were utilized for various tasks. The GLMNet library was employed for model development using elastic net regression. ROC curve are for model validation by generating ROC curves and calculating AUC scores, and VIP for like reproducibility, while populations are used to I also use performance function as that model was built using the GLMNAP library, incorporating L1 and L2 penalties to address multicollinearity and overfitting issues in high expression data. Hyperparameter to determine the optimal values of the alpha and lambda hyperparameters, which control the balance of L1 and L2 regularization. This step helped in finding the best performing model configuration. So for third step, model validation. The trained elastic net model was validated using the independent test data set. The performance was evaluated by computing area under curve scored of receiver operating characteristic curves generating with the ROCR library. Feature importance. The VIP library was used to visualize and identify the most important gene predictors of patient response was highlighted. Result interpretation. The final model's AUC scores along with gene rankings were interpreted to draw conclusions about the predictive capability of the identified biomarkers. These steps collectively allowed for the identification and validation of significant biomarkers for predicting patient responses to lung cancer immunotherapy. So for results, as I said, we analyzed 8,582 genes expression and discovered a subset 10 genes that were accurate predictors of patients' response at the 6-month past lung cancer immunotherapy. So these specific 10 genes are them. And I'm switching. So these are my graphs, my plots, my results. Wait. So for the first figure, it represents the most significant 10 genes in elastic net model for alpha value of 0.5. And we choose the alpha value of 0.5. Meaning L1 and L2 regularization was combined and balanced by a penalty. This can be understood by looking at the elastic net objective function. So for the second figure is ROC plots for alpha value of 0.5. As you can see, the area under curve as false positive rates is bigger than the true positive rate area, and that means our score is good, but not that perfect, because if our score is perfect, it will be like more closer to true positive rate, yeah, kind of thing. And yeah. So discussion and conclusion. As I said, the primary goal of the study is to identify novel and robust biomarkers that can accurately predict patient responses to lung cancer immunotherapy. These biomarkers provide insights into tailoring personalized treatment strategies, allowing healthcare professionals to make informed decisions based on individual the significantly improve the success rates of lung cancer and how lung cancer patients are treated. By integrating molecular signatures and biomarkers, clinicians can select the most effective immunotherapy options for each patient, thereby increasing treatment efficacy and minimizing adverse effects. The discovery of these biomarkers also paves the way of ongoing research into targeted therapies, monitoring disease progression, and refining treatment plans based on individual patient characteristics. So 1 second. Okay. The AUC and ROC a little bit more. ROC means receiver operating characteristics, models performance across different classification thresholds. It plots the true positive rate sensitivity against the false positive rate specificity. At the threshold for classifying positive and negative examples of very good will have closer to the corner thresholds. And you see, on the other hand, is the area under curve to ROC curve. It provides a single numerical value that represents the overall performance of a classification model. AUC ranks between 5, performs no better than random chance will, and AUC1 suggests a perfect classifier. In summary, the ROC curve and AUC are tools to assess how well a binary classification model distinguishes between positive and negative examples. The ROC curve visually displays this performance. And yeah, for acknowledgements, it was a really great experience working with Sarah, my mentor, and Talaria staff. Thank you everyone who gave me this chance to conduct a research paper.